what's something that people outside of healthcare marketing get wrong about your work?
A lot. I feel like they don't really have any idea. Like I was saying, like my mom to this day, I've worked there for 12 years. She cannot tell you what I do. She just knows I work at Hopkins, but she can't tell anyone what I do.
That's Supersonic healthcare marketing strategist, Azmina Rahemanji. And this is People of Healthcare Marketing, the show where I sit down with healthcare marketers to find out what it's really like to run a marathon in their shoes with ankle weights and mandatory checkpoints. That means no shop talk, just real talk about the life behind the job. Azmina,
Yes.
welcome to People of Healthcare Marketing. So right before we started recording, I told you, I don't care about KPIs. I don't care about campaigns. This is about what it's like to walk a marathon mile in your shoes with ankle weights, mandatory checkpoints, all of the things that you have to go through and why you do this work. So thank you for being here.
Thank you for having me.
To get the ball rolling, let's start at the beginning, because I've said this to many people in healthcare marketing. No one grows up wanting to be a healthcare marketer. No little kid in kindergarten puts it on there. I think mine was be a garbage man because I thought the garbage truck was cool at the time. So what led you to become a healthcare marketer?
So when I was younger, I wanted to be an artist. Not for any particular reason. I just liked art. So I'm like, I'm going to be an artist. And then I went to high school, and applying for colleges was so hard to wrap my head around. I'm like, I don't know what I want to do. But I did make a decision that I wanted to do something business track related. And my cousin is an accountant, and my dad is kind of the ringleader of our family. And he was very much into job security and where can you make an impact? Where can you make money? Where can you grow? So he was like, you're just going to try accounting. So I'll never forget the day we were sitting there before I decided to go to York College, and we were looking at the graphic design track, which I'm looking at over here, and he's looking at the accounting track. But I actually really wanted to be an architect. So I was trying to do something realistic with art. But the program was 6 years long, all summer. And that at that time when I was 17, that was really unattractive to me. So he's like, let's start in business and see what happens. And then I started doing the business core, and then I went into accounting. And like I was telling you last night, the taxation class, I was like, I can't do it. I was sitting there watching him write these numbers. And I'm like, what does this mean? This is so boring. And I told my cousin that night, talked to her on the phone a lot. I'm like, you know what? I was in this taxation class, and this is what they taught me. And she's like, you're just not boring enough for this. You can't do this. You need to switch your major. I don't care what your dad says. And I was like, all right. And so at the same time, I was taking just a very basic marketing class. And I really enjoyed it, and it was fun. And like I was saying to you before, I felt like I am really good at math. So that was one of the reasons the accounting thing happened. But I really liked art, right? And there was a scientific blend between it all. So once I started doing the marketing, I was like, whoa, I love this. And there's psychology and consumer behavior. And I'm like, this is awesome. So it went that way. And then my very first job out of college, well, I worked in retail. But my very first job out of college was at a recruiting firm, and I was doing marketing for them. And that led me to another recruiting. I was only there for a few months, and that led me to another recruiting firm, but they recruited healthcare professionals. It's nurses and doctors. And so that was my first kind of window into the healthcare world. But so I got to know just a lot more about it, and it was really interesting. And I felt there was no ceiling, I felt I could just go with this healthcare. So then I started looking into getting my master's degree, and I was either going to do an MBA, or a healthcare administration degree, but I didn't want to pigeonhole myself into any one thing. So I was like, I'm just going to get my MBA and see how this works out. And I got a job at Johns Hopkins. There was 3 of us that worked at my previous company, and we all got jobs there. And I started out working on the Department of Surgery. So we were just doing like marketing plans for doctors that were coming on board, like certain programs. We were doing email marketing. And I had been doing digital marketing in my previous role. And one of the things that Hopkins was looking for, their marketing department, they like really wanted people with even just a little bit of healthcare experience. And so like luckily I was able to get in the door. And it was really exciting because I'm like, now I'm on the other side, right? I'm like marketing the services versus trying to get them to go work somewhere.
Gotcha.
Yeah. So that's kind of how I landed there.
And so how long has this journey been for you?
The Hopkins?
The whole thing. So let's say from
the first
healthcare, yeah.
17 years.
Wow.
Yeah.
Feels like yesterday or feels like a long time ago?
So the first job feels like a long time ago. Hopkins feels like yesterday.
You just went that.
Yeah. And I've had all of my like personal life milestones while I've been there.
Yeah.
So it's just felt like it's just part of my life, you know?
That's
and
awesome.
It's gone really fast.
What's something that people outside of healthcare marketing get wrong about your work?
A lot. I feel like they don't really have any idea. Like I was saying, like my mom to this day, I've worked there for 12 years. She cannot tell you what I do. She just knows I work at Hopkins, but she can't tell anyone what I do. I think a lot of people think that marketing's all about like a product, right? Like Nike and Coca-Cola and like those big brands, and they need marketing because you want someone to buy something. Mm-hmm. And the service is the same thing. I think it's just harder to wrap your head around.
Yeah.
Selling a service to somebody. So the biggest thing when I started, and I asked my chief marketing officer during my interview, why does Johns Hopkins need marketing? Like everybody knows about Hopkins, especially if you live in that area, right?
I know about it, and I have no clue, like all the services. That's it.
And she's like, for a long time, because it's hundreds of years old, it's a legacy hospital. For a long time, people thought we didn't need anything, and we didn't. And then the landscape just changed, and healthcare just evolved so quickly. And it was like we couldn't, and I talked about that in my session today, we couldn't like hide behind our brand recognition anymore. We had to do more. Like we had to keep up. We weren't like, we had the legacy and we had the trust and we had the research, but we weren't forward. You know what I mean? Like, so a lot of people think that why does Hopkins have a marketing department? I mean, even to this day, like when I talk to people, they're like, really? Like Hopkins has that big of a marketing department? And they don't understand why we have to market because like a lot of people will say, well, if I'm sick with, a cardiac condition, like I'm just going to go to the cardiologist. I'm like, I get that. But like now I'm going to tell you all the great things that our cardiology team does and why you should come to our cardiologist. Yeah. And there's a whole lot of storytelling that goes on when we are trying to tell the world like what we're doing and what we have to offer.
Is that so like the people who don't understand why your job even exists, do they then assume your job is easy?
Yes, 100%. It's really hard. I mean, we have to manage multiple personalities. These people are doing mind-blowing work, right? They're curing cancer. Like this doctor I was on a call with last week is working on triple organ transplants, like for the same patient at the same time. And so it's hard because I'm like, hey, like, I want to do like this email campaign for you. And like when they feel really strongly about something, they think they're right because they know their work better, which is true. So I need to partner with them and they do know their work better, but I know how to tell the story better.
Yeah.
And so it's you have to get them to believe you and to trust you and to find your work to be valuable. And the outside world, like, let's refer to friends and family. They don't. I don't know what they think I do all day.
If you could rename your job title to better reflect what you do and help people understand what you do, what would it be and why?
That's a great question. I would call myself, I don't know, like a supersonic health marketing strategist.
I love it. I mean, it does make it feel like you're a superhero in a way, right?
Yeah.
Like it makes it feel like you supersonic, fast information. I feel like also too, there should be something about the curse of knowledge, because you're helping people fight it. You're helping the description you were just saying about the triple implant. Like they don't see the curse of knowledge that they have, and you're helping them understand that, yeah, if you went directly to people to talk about this, you'd be speaking Greek to them. Like you need to, and so you are like a translator that's speaking their language and the patient's language.
Very much so. And I think that all healthcare marketing needs to have some clinical track along with it, because we are like mini clinicians. Like I know, like I was saying, I know way more about prostate cancer than I ever thought I would know, than I want to know. But even at doctor's appointments, like if I'm with my parents or my kids and I'll ask for certain things, they're like, oh, are you a doctor? And I'm like, no, because it's just terminology and like the way of understanding. Then I'll sit in doctor's appointments with other family and friends, and like, it's a totally different environment. Like they have no idea what's going on. They're just doing what they're saying and like moving forward with their day. Yeah. But for me, it's like, it is the personal appointment, but it's also like work. You know what I mean? And it's interesting to work at a hospital and to do healthcare marketing because of the audience, right? Speaking to your audience is marketing 101 and figuring out who your audience is. And our employees, everyone that works there, is also part of our audience, right? So anybody is really, like, you could be a child, which obviously we're marketing to their parents, or you could be like 110 years old. It doesn't really matter. It really applies to everybody.
With all the things that need to be, you're up against and the challenges, what does success actually look like for you today? And has that changed in your tenure in healthcare marketing?
So I get a lot of satisfaction from having these report out meetings that we do with these like high level like chiefs of divisions. So we'll do it, let's say like biannually, and we'll put together like everything we've done to support all of their divisions. And it's pretty nerve wracking. And then when we do it and we present it, they're blown away. So like we're blown away by their work, but they're like, wow, like this is such a great story, and like this video is amazing, and like all of these different things that you did to reach consumers and physicians and all of these metrics that you've put together. Like they really feel supported by us. And then it gets better when a patient is like, I saw your video on hyperhidrosis and I didn't know anyone did anything about that. So like, that's how I got to you. And that's really special, because it's like, we worked on something to try to get a message to somebody, and when they get it, it's really amazing.
That's good. Like, because like I said, like the numbers are great, helping the hospital like achieve, stay afloat, make its goals, but at the end of the day, it's about the people. Right.
And trust me, I'm not in it for the money. It's not that at all. It's really being able to help people. Like if I could like look back 20 years and be like, I wonder like what, because medicine interests me so much more now than it used to. When I started, I couldn't look at a picture with like blood and guts, and like now it doesn't even faze me. Mm-hmm. But I love it. So I'm glad that I get to be a part of it, and I get to also make an impact. That's what I would also say. I think people might get wrong. Like, they don't think that healthcare marketers make a direct impact, but we do. We're not the ones with like doing the sutures, but we're the ones telling you where to go get your sutures.
Yeah. Like you wouldn't find healthcare today without you. Like
right.
When people think like, oh, I'm just going to Google it. Well, yeah, that's how it's going to show up in Google.
Yeah, we're behind all that.
Yeah.
And there's a lot of noise. I talked about that in my session today for physicians and consumers. They have so many options, and it's like, what's important to you? Like, is it location? Like, is it really important for you to be like close to your job or close to your family? Or is the condition that you're facing something that you really need to seek like a super specialized person for, and you're going to have to travel? Or is it for your kid? Or like, it really depends on like what is important to you.
What do you wish that leadership understood better?
Just how much goes into it all. Because we don't sit there and say we spent the last 6 months working on this, and they just end up seeing like this pretty package tied up in a bow, right? And it's like, how we got there. Like they were part of it, you know, they were part of the discussions. They were probably part of an interview or a video or whatever we ended up doing with them. But everything we had to do from like the inception of the idea all the way to where we're distributing whatever product we're coming up with, they don't fully get all of that. The other thing I would say is all of them have their own ideas, right? And so it's like somebody wants to do this like glossy 20-page overview book about their division and send it to all the referring providers in the area. I'm like, that's going to cost like $80,000. It's going to take 1 year to make. And they're like, well, and I always ask them, would you refer a patient if you got this? And they're like, of course I would. But then the doctor down the hall will be like, that's the dumbest idea I've ever heard. So it's like managing all of these personalities. And I just want to be like, just listen to me. Like, I know how to get the information to them. You just have to give me the information. So,
on that note, what's something that you've accomplished that no one's ever clapped for?
That's a good question. I would say the majority of my job and all of my colleagues that I work with at Hopkins is relationship building. So that takes a long time and it takes a lot of effort, and you have to really get these people, whether they're in clinical ops, whether they're administration, whether they're doctors themselves, you have to get their buy-in or they're not going to listen to you. So I think it's similar marketing a different product or a different service, but this is so intimate to people, right? It's so personal. There's so many privacy regulations. It's like you have to get them to buy in, and the relationship building is the majority of the job.
Yeah, and that's very invisible.
Yeah, it really is. And I would say, to answer the actual question of no one clapping for it, I've dealt with some really difficult physicians that have like put me in tears, that have like, you know, I've been really stressed out about. And it's like stuff that like to me wasn't anything to really complain about, but that was just their personality.
Yeah.
And I'm like, you have no idea about all these different things I'm doing for you, and just because you don't agree. And so I think managing those personalities is something all of us in healthcare marketing should be applauded for, because that's most of the job.
Do you ever encounter burnout from any of that? Like, what other ways does burnout, and I mean, what does it look like for you? How does it manifest?
It's just like so there's two sides. Burnout's harder for me to get to because there's so much variety in my job, which is why I stay.
Gotcha.
I'm never doing the same thing twice. There is some burnout with like the people that we're dealing with. The ones that like, you know, you can't change their mind, and like there's conflicting information. I mean, I even had one sitting with me at a table saying, I think I'm sending you mixed messages. I was like, yep, you sure are. And when that kind of stuff happens, it's pretty deflating. It just makes me tired. Like all so around, like mentally and physically, you know?
Yeah, because like even though you have the luxury of being able to like switch context to something else that gives you the dopamine hit that makes you feel better, that's still the thing. And so it's obviously going to take a toll on you because you can't just ignore it.
Right.
When you think about how healthcare is just constantly evolving and changing, but then a lot of things stay the same. If you look at 5 years from now, realistically, or total magic wand, what do you hope changes in the next like half decade?
I hope that people get access to the stuff they need, because I think, there's really long wait times. It's really hard to get in with people. Medication's expensive. I just hope that we can get to a place where like everyone is getting what they need, because this isn't like designer shopping, right? It's not like I want a Louis Vuitton bag, but I can't afford it, so I'm not getting one, or I can afford it, so I'm going to go buy one. It's like, this is my health.
Yeah.
It's
not a choice.
Right. And I think that's one thing. But on the flip side, like actually on the way flip side, I'm really interested in like prevention and like wellness.
Yeah.
That angle I always have been. And we are so reactive still.
Yeah.
Right. And like, I'm reading all these books about how like, oh, does your physician ever ask you how you sleep? And does your physician ever like ask you what you ate that week and that kind of stuff? It's just like, oh, like you're having GI issues, like here's some medication, or like,
yeah, they don't think about the holistic or other factors that are contributing.
And I think that's shifting. I feel like it's really slow, but it's happening. So in 5 years, like if I could wave a wand, I would absolutely want that to be integrated in everything that we do.
That'd be awesome. Like I was recently reading about ADHD and how it's, in many cases, it is the right diagnosis, but in sometimes it's like there are other contributing factors, like how, like the study I was reading was about how certain demographics in like impoverished, like poorer people tend to have a higher rate of ADHD. And it's like, well, of course, because they don't know when they're going to have their next meal. So how can you concentrate in school if you don't know when any of that's going to happen? But they end up giving them medicine because that's just the straightforward. And so I think studies like that in other realms are leading to the trend that you're hopefully going to see change over the next 5 years.
Yeah. And I do feel pretty optimistic about it. So
me too. You've been doing this for quite a while now. Someone who's starting in this field today, what advice do you have for him?
That's a tough one. I would say you have to be a really good listener for a long time. There's been people that have come into our organization, maybe not at like a super junior level, at all different levels, and they just want to like impress you and do stuff. And I get that. I totally get that. But you have to be a sponge for a long time. There's so much information that you have to understand before you can go market this service. And, you know, a lot of people think marketing's a skill, right? And the skill that so the industry is what you're marketing, and the skill is the actual marketing and the strategy. A lot of people think you can just go and market anything if you have the skill, right? And the education and the background. I don't fully believe that. No. So I think that you have to, and if you are going to switch industries, which I'm all about, like, I don't want to be pigeonholed. Like, I feel like where I am right now, like, I love healthcare and I want to stay in it. But for anyone else that wanted to switch industries, I'm totally supportive of that. But I think you have to listen and you have to become a sponge and you have to learn and you have to figure out like the audience. You have to figure out like, what are the differentiators? Like, you need to know all that stuff before you can do anything. Because I think people get ahead of themselves and then they're not set up for success.
What's the reward of being a sponge? I mean, you've been here for quite a while now, so there has to be a reason. Like, is there a tipping point when, like, a benefit where once you have absorbed it, you talked about, you know, what your job title would have been. Like, is that the reward?
No, not at all. I think it's developing confidence. And I think that all goes back to the relationship building. Like, if you walk into some of these doctors' offices, they're going to be like, what? You know, like, you have to come in with confidence, and you will not be confident marketing their services unless you understand them.
Before we wrap up, I want to have a few fun questions. Is there a phrase or, let's say, jargon, platitude that you're sick of hearing and never want to hear again? You want to abolish it?
I think I have a lot of them.
Just one.
The funnel. God, I'm so over the funnel. Like, stop. The top of the funnel, the bottom of the funnel, I'm over it.
Same. Oh man, I think we should have a drink and talk about that later.
Like, how can we
get rid
abolish
of it?
the funnel?
I am with you. Team, kill the funnel.
Yeah.
And I feel bad saying that because some of Freshpaint's marketing has the funnel in it, but
we all talk about the funnel.
Everyone, it's a useful construct, but it doesn't exist.
Right.
Speaking of things that don't exist, if healthcare marketing were a reality TV show, what would it be called, or what existing reality TV show would it be like, and who would the characters be?
Oh my gosh, that's so fun. A reality TV show. Oh my gosh, I have no idea. I do not know how to answer this question. I just keep thinking of Grey's Anatomy, which is not a reality TV show, but I feel like it would be similar to that.
Before we end, I want to ask you one last question, which is, what makes the work worth it? Why do you show up?
I show up for my personal reason for showing up is the fulfillment I get from the variety. Like if you ask a lot of people at Hopkins how long they've been there, it's been a long time. And I wondered that when I first started there, I had only had one other job, but we were going to like a retirement celebration that week for someone like in marketing. And I'm like, we're going to a retirement celebration? This is crazy. This person's retiring from here. Like, never in a million years thought that that was an option. Like, I thought you just got a new job every 4 years. But the stuff that I'm talking about is just amazing. I mean, we're talking about devices that we implant in people that have metastatic liver cancer to target just the tumor, because if you destroy the cells in the liver, it causes organ failure. Yeah. I mean, they've thought of so much stuff that's just insane. And like transplantation, completely mind blowing. I mean, we just worked on a story last week of two moms. This mom like lost her son young, and it was a very unfortunate situation. And another mom brought her son, which was the friend of the one who had passed, over to like give condolences. Turns out the mom that still has a son like needed a liver. It just came up in conversation. And the mom who had lost the son said, you know, like, I just went through this immense grief and like this really wild situation. And I want to do something to like, just, you know, something impactful. And she donated some of her liver to this other mom, and they got like matching pajamas in the hospital, and they have pictures of their sons when they were like little catching frogs. And like, it was really something. It was really insane. And those are the reasons why I go back, because I get to talk about that stuff.
Trying not to cry, because that's just such a beautiful story.
Yeah.
Azmina, you have been the epitome of why I wanted to do this series. I really wanted to thank you for being here, to know the people who aren't just hitting KPIs and sending out ads and doing A/B testing. There's really like a human behind all of it, and a human that has bigger picture of what you're doing. So thank you for sharing everything.
Thank you. This was great.
For Azmina, the best healthcare marketers are translators. Translators between clinical excellence and human understanding. Because behind every medical breakthrough is a story to be told and a patient who needs to hear it. And that's the unspoken truth here. Because behind every compliance checklist and cautious claim are people. People who believe in what medicine can do. People who found meaning in the margins. I'm your host, Ronnie Higgins, and this is People of Healthcare Marketing.